listening to Everyday Evidence, presented by the American Occupational Therapy Association, helping the occupational therapy practitioner apply evidence to practice. Here's your host, Matt Brandenburg.
All right, today we are joined by Emily Barr. Emily, thank you for being on the show to share your knowledge and expertise with us.
Hi, thanks for having me.
Of course. I've been looking forward to getting to know you a little bit. Our topic for today is patient safety. And as such, we are going to be discussing some of the research and advocacy efforts you've been involved with as the executive director at the Nebraska Coalition for Patient Safety. Can you introduce us to your role in this position?
Absolutely. Thanks for having me again. I'm Emily Barr. So I am, as you mentioned, the executive director of the Nebraska Coalition for Patient Safety. We are a federally listed patient safety organization. So what that means is we are federally listed through the Agency for Healthcare Research and Quality. There are about a little over 100 organizations like us in the country.
You're a federally listed organization. I assume that just means you get funding from the federal government, or what is the significance of that?
Yeah, that's actually a good question. So patient safety organizations do not receive federal funding, actually. So every organization is unique and different in how they acquire fees for the services that they provide, but we are not federally funded because of the credentialing that we have from AHRQ. We do go through a credentialing process. So very similar to what a university might go through, for instance, where we have to demonstrate specific pieces of evidence that we are completing specific criteria in order to be called a patient safety organization.
Oh, okay, wonderful. So it's kind of a standard or a title that shows that you're authorized to be providing patient safety guidance and encouraging patient safety best practice?
Yes, exactly.
Okay, very cool. I'm interested to learn more about this organization and your role in patient safety. Why is patient safety such an important topic, would you say?
First of all, all of us are consumers of healthcare at some point in our lives. So really understanding the unique needs of individual patients and different populations and creating a space for patients and families to feel like they are a member of the healthcare team is so important in really supporting the best practices of care and supporting decision-making throughout that process. I could probably go on and on about statistics and, things that are happening in regards to medical error across healthcare systems in our country, but it is such an important topic because of medical error that is happening in our organizations. There is a lot of healthcare costs because of things that happen within the healthcare space, but it also can have long-term effects on patients and their family members. So really addressing patient safety is really this discipline and science is just so important for the overall healthcare system.
Absolutely. Something that should be a priority in addressing for all practitioners. What specifically is occupational therapy's role in the broad subject of patient safety?
OT professionals, we work with our patient populations really at all points in their continuum of care, whether it's in the early stages after an acute episode in the hospital or in skilled nursing or outpatient, home health. You name it. OT professionals work with our patients everywhere. And so it's really important that we recognize what those safety priorities are, but also how our skilled services that we work on with our patients really can carry over into their next level of care. And so because we address such a multifaceted approach to how we work with our patients, it's important to really understand the role and leadership I would say that OT professionals have in ensuring the safe care and carryover, as I mentioned, of those services across the continuum.
I love how you mentioned a leadership role for occupational therapy practitioners. Why do you think OT as a field is so uniquely suited to be addressing patient safety and provide leadership and guidance in kind of leading the charge and coordinating patient safety efforts?
I believe because of the way in which OT professionals evaluate and create goals for our patients and really look at what does that level of independence look like for each individual patient. We are a very unique profession in that we're examining all of those factors simultaneously to create the best plan of care. And that's why I say OTs can be such leaders in this space, because we're looking at factors that other disciplines might not be considering when they're looking at things such as transition planning or what that next level of care might be. And as OT professionals, we're really taught to engage the patients, families, and other caregivers in that decision-making process. This has been such an emphasized topic in the patient safety space in the last year of really what are some of those tools and resources to better engage patients and families in the care process. And in my mind, I get really excited for OT professionals because that's something that we have always done. That's what leads me to say that OTs can be leaders in this space, because some of these best practices are practices that OT professionals have been doing already. So I think that's just really important to call out for our OT practitioners.
Absolutely. Absolutely. Thank you for bringing attention and advocacy efforts to this topic, because I totally agree. I think the OT lens can apply so well to this topic of patient safety, and it has become, a bit of a hot topic. For example, in its 2023 report on transforming patient safety, the President's Council of Advisors on Technology and Science, or PCAST, underscored the urgent need to upgrade public reporting of serious avoidable harm events as a national priority for patient safety improvement. And I think you know way more about PCAST and this report than I do. So I'd love to ask you some questions about it. First one being, what is the President's Council of Advisors on Technology and Science?
Sure. So this is a federal advisory group to the current Biden and Harris administration, and they essentially advise the administration on these types of topics related to science and technology, with patient safety being one of those topics. A little bit over a year ago, there was this report that you referenced that really brought a spotlight back to patient safety. Some of the listeners might recall in about 25 years ago, end of 1999 into 2000, there was this landmark publication that's called To Err is Human. And it was put out by the Institute of Medicine. And what this initial report highlighted was really the significance of medical errors and deaths that were happening in the U.S. health system, which really a lot of them were considered to be what we call preventable events. So even 25 years ago is kind of how I like to highlight the beginning of this patient safety movement, right? Where there were recommendations even back then on ways to really transform and improve patient safety in the United States. So we fast forward almost 25 years, and what this report with this PCAST group contributed to is patient safety continues to be a significant issue in the United States. Some of the comments that the contributors noted were things such as approximately 1 in 4 Medicare patients experience an adverse event in a hospitalization stay. One of the big highlights of this report that I found interesting was the significance of diagnostic error that's happening in organizations and how much money is really being spent on these different healthcare costs related to what they categorize as preventable adverse patient safety events. Something about that report, there's still significant room for improvement related to errors within our healthcare systems. But they did highlight some of those things that have improved since that initial publication I mentioned, To Err is Human. We've done a much more thorough job of infusing evidence-based practices into the clinical environments. We've done a significant improvement with really looking at some of those root causes of events that happen. So it did highlight some of the progress that has been made in the patient safety space, but it really was that re-emphasized call to action to really put a national focus and priority on improving patient safety.
Yeah, 25% of people are experiencing an unavoidable adverse event. That's definitely a wake-up call. What did the report on transforming patient safety recommend to address some of these disparities and lower the incident rate of these adverse events?
So there were these 4 overarching recommendations, and each recommendation had corresponding tactics to kind of reach these goals. But the first was really re-emphasizing that federal leadership for the improvement of patient safety as that national priority. The second one was to really continue implementing evidence-based practices and really emphasizing that importance to prevent harm. The third one was partnering with patients to reduce disparities in medical errors. That was one that was highlighted quite a bit of really looking at some of those just differences in percentages of medical errors across different populations. And it really kind of showed what those disparities are. And then lastly, accelerating research and implementation of new technologies. So as I mentioned, there were quite a few tactics with each of these overarching goals, but those were really the main priorities or recommendations, I should say, that came out of that report from the PCAST contributors.
Thank you for that summary and those extra insights into the report. I think there's been good response in making progress in terms of patient safety. What would you recommend that practitioners understand about the National Quality Forum specifically and that organization's efforts to update serious adverse event reporting criteria?
Mm-hmm, mm-hmm. I think it's important to recognize each organization's efforts and work in identifying and working towards these big goals of improving patient safety. So, there's a lot of organizations that are in the patient safety space, of course. But with the National Quality Forum, one thing that the group is doing right now is updating their serious reportable events criteria. This was last updated in 2011, and a lot of organizations use the NQF criteria to really define what those types of events are within their organizations. So this group is really looking at to really make sure it's aligned with the evolving healthcare landscape. Obviously a lot has changed in that time period between just different evidence that has been implemented in the clinical settings, technologies, of course. So really those efforts have been to review different definitions that organizations use, criteria of those events that occur, but also what are those practice settings as well? So are certain events applicable, for instance, in specific practice settings where patients receive care? So this group is really currently reviewing this criteria, and there's experts across many different disciplines, and their work is really to ensure it represents the most accurate, the most effective language that can be used to support the learning process and the improvement process for healthcare organizations.
Okay. I like that. It seems like a beneficial approach to improving overall patient safety. And, it sounds like the National Quality Forum is really emphasizing, standardized reporting measures of patient safety to help coordinate efforts and help inform best practice. How are these current patient safety reporting structures designed? And what do you think can be done to improve them further?
Reporting structures, they really vary depending on the organization. So I would say there's not one specific set of standardized reporting mechanisms among practice settings, or really even within the same practice setting. And in some way, that is very appropriate, as not every organization operates the same. But on the other hand, it does make efforts to standardize information more complex in order to really understand that aggregate patient safety data that is received. So in some sense, there is that challenge of really understanding, how are we collecting this type of information in a standardized way to really know, as we're looking at it in the big picture, are we actually moving the needle at all in our patient safety efforts? There's pros and cons to not having that standardized structure, I suppose, because it's really impossible to effectively have just one system to measure all things within every organization. But it does make that process just a little bit more complex because of that.
We talk about these measures. What are some of the, potential adverse events that these measures are designed to pick up? Or what exactly are the data that these measures are collecting? What does that look like?
With our patient safety organization, most of the organizations that we serve are hospital-based settings. Now, I do want to mention that patient safety situations do not just occur in hospital-based settings, right? They can occur anywhere that patient care is delivered. Some of the events or data that we look at in particular are things such as the event type. So this is really understanding more what occurred. So this could be something such as a patient fall, a medication error, a surgical error. Those are examples of what we would gather in terms of an event type. Another category that we look at is, what is that severity of the event that happened? Meaning, is it something that did not reach the patient and we caught it ahead of time? Or is it something that reached the patient and potentially caused significant harm as a result of the event that happened? That's another big data point that we look at. And then I would say the third one is, what are those contributing factors? So we know what happened, but those contributing factors really help contribute, as in its definition, to telling us more about why it happened. So this could be things such as communication breakdowns, transition breakdowns, things of that nature give us more insight into why a certain event or a situation occurred.
it's starting to click for me. You're collecting this information on the type, severity, and contributing factors to an adverse event. How is, developing a set of consensus, reporting standards that deal with these descriptors or factors? How is that going to improve the patient safety efforts of an organization or a specific therapist?
There has been quite a bit of work done in efforts to develop a more structured and standardized approach to reporting events, the process of collecting events, and analyzing that patient safety data. So I mentioned this organization earlier, the Agency for Healthcare Research and Quality, or AHRQ. They've done significant work and have had several versions of what they term common formats. And these common formats, they look at specific reporting questions, identifiers, in order to support that more standardized taxonomy for gathering that patient safety data. So I mentioned in a previous question how our organization mostly looks at hospital-based information, but patient care happens and patient safety events can happen in all places where patient care is delivered. So there are these common formats for other locations, such as long-term care facilities, for instance. We take these more structured taxonomies for gathering this data, and that gives a little bit more of a streamlined process for collecting that information, but also aggregating it so that we can really start to see what are some of these themes that we're noticing or trends in our patient safety events. And really the whole purpose of this and the whole purpose of patient safety organizations is to effectively utilize that data to make change. We're not just collecting data for the sake of collecting data, but how are we producing different resources and tools to the organizations that we support to really create change and learning so that we can help mitigate future risk based on what we're finding is happening through the patient safety data that we're receiving.
What have been some of those factors related to patient safety that practitioners should consider to inform and guide their own care delivery?
Sure. So I think practitioners, and I would say this even relates to all practitioners, not just OT practitioners, but really consider components that make up what we call in the patient safety world a culture of safety. And these components include a few different things. So first and foremost, creating what we call a reporting culture. And what this means is where all team members feel like they have that psychological safety in the places that they work, where they feel comfortable to speak up when an error does occur or when there is a situation where there is a system vulnerability, right? Where something could happen. Another component of that is the emphasis on teamwork. How are we using our emphasis on reporting to really collaborate with one another to embrace what we call a learning culture? And in order to have a learning culture, we're actually taking action based on the information that we are receiving in order to make change and prevent future harm. So I think really understanding how we all have such a role to play in speaking up for safety, I think that's such an important thing to consider and just be mindful of.
I really love how you emphasize the importance of culture and the importance of community efforts to encourage patient safety. I think all practitioners will benefit from rallying around their community and including coworkers to emphasize patient safety and ensuring, first off, that a practitioner feels safe in addressing some of these, organizational factors or system factors that may be leading to some of these adverse events. What can practitioners really do to improve patient safety practices within their clinical settings?
To my earlier points about those components of building a culture of safety, I think practitioners can really support the settings that they work in by speaking up when things occur or when there is those observed unsafe conditions or vulnerabilities in the system that could be a future problem. And I think just as important is really supporting those communication efforts and teamwork approaches. As OT professionals, we are very used to involving patients and their families and creating care plans and their transition plans. So really continuing to ensure that remains the case by involving patients and their family members is really important.
I love that. I love that emphasis of collaboration and empowering patients to, take steps with their caregivers to ensure their own safety. We'll get back to our interview right after this quick message. You all know we really try to make research more consumable and applicable on everyday evidence. But did you know that just 1 minute of your time could help us to improve the show, improve the resources the American Occupational Therapy Association provides for practitioners, and improve the application of evidence to practice within our whole field? Please take our 1-minute survey. It's only 3 questions, and you can find the link in this and every episode's description, and support the AOTA in continued efforts to improve our podcasts and to improve the translation of research to practice. Now back to the interview. Can you share maybe a clinical example of implementing a patient safety system that contributed to a positive outcome for patients?
Sure. This example is from when I was practicing more in the long-term care space. And our teams, we worked to implement a facility-wide cognitive assessment approach. And what we did was we provided education to all of our team members, no matter what their position was within the organization, on how our functional cognitive approach that we were utilizing with all of our patients and residents would allow for a more complete and quality plan of care. So what we did is we used this assessment method to educate, as I mentioned, all of the team members, but also all of the family members that were involved in the residents' care. And because of this, it really supported how we approached their ADL tasks, their mobility tasks, potential safety cues that we gave them. But, I think the most important safety component out of this example was the efforts we took to communicate the process we were implementing system-wide. So I mentioned contributing factors is one of the things that we look at when we're reviewing patient safety data. And communication is one of the highest or most reported contributing factors to patient safety events. So it was clear to us at that time, by having a really clear process that supported individual patient care and their quality of life of each of those individual residents, it significantly impacted the outcomes for them.
That sounds like an amazing intervention. I think the goal of every practitioner is to empower patients to be more independent. And I really am noticing how patient safety is built on that same foundational principle of we're not just here to ensure our patients are safe when we're directly caring with them one-on-one, but we want our patients to be safe in all aspects of their life. And really it takes coordinated and deliberate efforts to encourage that level of safety.
Absolutely. And it's exciting to think about, at least for me, with OTs in this patient safety space, because this is just how we have learned in our skilled training and how we deliver skilled care. We're always looking at how the things that we're working on in intervention planning and transition planning, how is this impacting the patient's safety to perform those tasks in their most functional and independent way. So, that's why I've kind of reiterated several times why I think OT professionals can be leaders in this space, because, this is just something that has been so ingrained in us. It's just part of how we deliver care.
Yeah. Absolutely. Absolutely. I love that, Emily. What additional national efforts to improve patient safety should OT practitioners be aware of?
Right now, one of the bigger changes from CMS is called the Patient Safety Structural Measures. And this is set to be implemented at the beginning of 2025. And what this structural measure looks at is really driving action and improvement across, they've categorized this in 5 different domains. And all of these domains are really rooted in best practices and evidence for really promoting patient safety with that total systems focus. So the CMS patient safety structural measures is going to be looking at things such as leadership's prioritization of patient safety. How is patient safety ingrained in an organization's strategic plan? How is an organization really building that culture of safety, as I mentioned, and really prioritizing patient and family engagement? So when I was first reading about the CMS patient safety structural measures months ago, something that really intrigued me and I was really happy to see was a lot of the topics that we as a patient safety organization speak to are included within this structural measure. Hearing and seeing these phrases such as building that culture of safety, involving patients and their families, these are things that we have been talking about and working towards for many years. But, the CMS, the patient safety structural measure that I'm referencing, this is right now for hospitals participating in the Hospital Inpatient Quality Reporting Program and the PPS. But there are many other resources and things that I think practitioners can be aware of. But those domains that I mentioned, even though they might not be directly tied to the practice setting that OT practitioners may be working in, I think they just speak to the best practices of patient safety. So I definitely would recommend OT practitioners familiarizing themselves with some of that language in that patient safety structural measure.
Yeah, absolutely. We'll be sure to include a link to that measure in our episode description so listeners can access it and review it. It sounds like such an important document and can be really helpful in learning about patient safety. How would you recommend a clinician approach that document and approach, any ideas that they might have and want to bring to their own organization? What should their next steps be?
First of all, the document that I'm referencing is, I think, a little bit over 1,000 pages. So it's definitely not something for light reading, but there are, and we'll make sure to include this too, quite a few just more summaries of this structural measure that I think are more appropriate for reading. But using those, the thing I liked about these structural measures is while there are those overarching domains that are going to be looked at in more detail, there are those strategies and really questions that guide organizations in their planning of their patient safety efforts. So within each of those 5 domains, I believe there are 5 questions under each of those. And really the formatted like an attestation statement where organizations can go through these questions, 25 in total, and they answer yes or no to the questions. But depending on that, it really gives organizations a chance to reflect upon what are the things that are going well in our organization currently, and what are those priority areas that maybe we need to be considering as we move into another year or implementing a specific patient safety initiative within our organization. I think all of the domains and the attestations in each of the domains gives a really thoughtful roadmap for how organizations can organize and create action items for patient safety initiatives within each of their own organizations.
Okay, it sounds like a very helpful blueprint in bringing about improved patient safety efforts. How else, Emily, have you seen occupational therapy demonstrate its unique value in decreasing patient harm and implementing best clinical and quality improvement strategies?
OT professionals have this distinct value because we're able to look at each individual's plan of care to what is most meaningful for them. So our profession is unique in that we evaluate and treat and plan for transitions with that very holistic mindset for our patients. So we look at client factors and performance patterns and all of the different contexts that our patients might need to encounter. And I think the most important feature of how we approach the OT process with our patients is that we place priority on what is important to them. So we're very much targeting the specific needs of each individual patient. And because of this, I really encourage OT professionals to seek out opportunities where you might be able to join a committee or a work group of some kind that examines safety events. And this can look different depending on the organization that you're a part of. This could be something such as being a part of an event investigation team, part of a safety committee, part of a quality improvement committee, really whatever that may look like, because I guarantee that the OT perspective will provide for a much more robust problem solving and action planning discussion because of the ways in which OT professionals approach our clinical practice.
I love that. I love that. So much of OT's value is being able to identify the most meaningful factors of someone's life and the occupations that are really going to resonate with them, and how to prioritize safety in those real life activity examples. Emily, what have been some of the most memorable or impactful moments that you've encountered during your own work and advocacy efforts related to patient safety?
My position is unique in a sense that we're the only patient safety organization in Nebraska. So we represent Nebraska healthcare organizations. Probably some of the most memorable or impactful moments have really been the opportunity to collaborate and learn from other state and national associations. So part of the work that we do, we very much collaborate with organizations like our state hospital association, our state medical association, pharmacists, all different types of clinical-based professional associations, but also with those national groups as well. So I have just had such a great learning experience to collaborate with leaders of these organizations to not only understand what are some of those priorities or concerns across disciplines within our state and our region, but also understanding what are some of those factors from a national level that I need to be bringing back to Nebraska? What are some of those legal implications that I need to be mindful of when we're looking at this type of data, for instance? So, I wouldn't say there's one specific impactful moment that's necessarily stands out more than another. Just the opportunity to really collaborate with these local and national leaders in improving patient safety for those in Nebraska and those across the United States has just been such a great learning experience and such a privilege.
It sounds like such a special role and function within that organization and group, and representing OT and bringing the OT lens to your efforts related to patient safety. Emily, what additional resources related to patient safety would you recommend to our listeners?
AHRQ has so many resources on their website, and I utilize those resources constantly, whether it's for specific articles or toolkits on best practices, but also those resources that are local to you. So I mentioned some of those state associations just a little bit ago, really reaching out and understanding patient safety priorities and concerns across the interdisciplinary team are great resources to have. So we very much emphasize that interdisciplinary practice. So I think approaching patient safety from that same mindset is also so important. So definitely reaching out and recognizing just other professions' contributions and concerns and priorities in the patient safety space can provide so many resources as well.
The importance of community once again emphasized, and hopefully our listeners are encouraged to look more into this topic and become leaders in patient safety within their own organizations and states, and even potentially at a national level, like yourself, Emily. We end every interview on this show with our golden nugget segment. Emily Barr, if you could share one piece of advice or one recommendation with practitioners, what would you say?
I think in just the topic of patient safety, really recognizing the significance of what OT professionals contribute to the interdisciplinary team. And my advice is to really seek out those opportunities to serve in some capacity for quality improvement efforts. And this can be something such as serving on a task force of some kind, or improving communication within your team, and also really looking at what is your personal role as a leader in this space, and how can you support current team members or even OT students that you might take in really promoting the importance of the OT profession. I think that would be my advice, is just really that recognition and realization of the role that OT providers have in this space of patient safety.
I love that. That's such a wonderful nugget. You've shared so much awesome information with us today, Emily. Thank you again so much for sharing your time.
Absolutely. Thanks for having me.
Thanks for listening to Everyday Evidence. Tune in next time for more evidence-based practice insights and applications.